Thanks for joining me on Straight Talk. I'm Ashley Korslien in for Laurel Porter. October is Domestic Violence Awareness Month. It's a time to mourn the people lost to domestic violence and come together to create change in ending the crisis. Now, recently in the Northwest, we have seen several high-profile cases of domestic violence that end in tragedy. A mother and daughter were found dead in Washougal, the mother's former boyfriend charged with their murders. A woman strangled to death after her partner is bailed out of jail in Portland. A mother shot and killed in the parking lot of her kid's school. A family of 5 killed in a murder-suicide. But there are many, many more cases that never make the headlines. In fact, each year in Oregon, nearly 40% of women and 36% of men experience physical abuse, rape, or stalking from an intimate partner. The latest data from the Oregon Health Authority shows that 21 people were killed by an intimate partner in 2021, and 3 children were killed. Now, although domestic violence crosses barriers of race, class, and sexual orientation, marginalized communities face a higher risk. Black women face intimate partner violence at levels 35% higher than white women. 48% of immigrant Latinas in one study reported that their partner's violence against them had increased since they immigrated to the U.S. And 30 to 50% of transgender people experience intimate partner violence at some point in their lifetime. Today on Straight Talk, our guests are Kelly Harris, a mother whose daughter Kelsey died by suicide after she survived a domestic violence incident where she was strangled. Since her daughter's death, Kelly has become an advocate for domestic violence survivors. She successfully fought for new legislation to provide resources for crime victims in Oregon. We also have Savannah Powell, a forensic nurse examiner and researcher for Providence Medical Forensic Services. She cares for survivors of violence at Providence hospitals and is a nationally certified sexual assault nurse examiner. And we have Elizabeth McKeever, the education programs manager at Raphael House of Portland, who has worked in domestic violence advocacy for a decade now. And Raphael House offers immediate shelter services and a wide range of other supportive services for domestic violence survivors in Oregon. Now, today we're going to talk about how to identify domestic violence and the resources available for people who need help. Thank you all for joining me to talk about this really important conversation today. I would like to start with talking about what to look for when it comes to signs and signals of domestic violence. Elizabeth, we'll start with you because it can really take on different forms and can often be overlooked. So what should people look for when it comes to the signs?
Yeah, thank you so much for having me.
Sure. And let's start with physical. I apologize.
Sure, yeah, absolutely. So I think physical abuse is the one that most people are familiar with. It's certainly, I think, the first thing that comes to mind for folks when they talk about, they think about domestic violence. These are things like pushing, slapping, holding someone down, using objects as weapons against someone, and then, of course, things like sexual abuse and rape.
And emotional abuse is another big one that is talked about a lot.
Yeah, absolutely. I mean, emotional abuse can look like name calling, just really speaking very negatively to someone, really trying to wear their confidence down. And really as part of that too, isolation from social networks, so from folks in their lives who are supportive. That isolation is really key to sort of creating this dynamic of keeping someone in an abusive situation because they don't have those resources anymore.
And you mentioned that social component. Talk about social abuse specifically. What are some of those signs?
Yeah, so I mean, we really think about community as sort of the antidote in so many ways to domestic violence. So if you are controlling who someone can talk to or to see, or saying, you can't talk to someone of the opposite sex, or there's sort of jealousy or accusations of cheating. There are a lot of ways that folks really end up feeling like I have no way out of this situation, and there's a lot of self-blame that comes into that too. People feel like I deserve this or I did something to provoke this.
A last one I want to hit on today is financial abuse.
Yes.
That might be one that people might not identify if they are being abused in that capacity. Talk about those warning signs there.
Yeah, absolutely. I mean, money is power, right?
Sure.
So what we see in financial abuse, and for folks that we serve at Raphael House who are, especially folks who are in our shelter, the vast majority of people who come in have experienced financial abuse. That can look like not being allowed to work, not being able to keep their paycheck if they do work, or really just just not having any awareness or control of finances at all. And unfortunately, what we see is people, when they sort of are in a point where they're getting away from that relationship and wanting to start over, that they find their credit is ruined, or they have an eviction that had to do with the abuser that is now about barrier to housing for them. So very, very common and not talked about very much.
Elizabeth, thank you for talking about those warning signs. Now, if you or someone you know is going through any of these things, maybe you identify with some of these warning signs and you'd like to get help, we would like to put up some numbers on your screen right now. We will also keep the National Domestic Violence Hotline number running at the bottom of the screen throughout the show. This is important. You can call or text that number. Again, on your screen there, 1-800-799-7233. If you need it, we also have local numbers on your screen, a number specifically for children and one specifically for people who speak Spanish. So again, we'll keep that national number up on the bottom of your screen. I'd like to talk about the scope of the problem now. We did mention some of the higher profile cases in recent years in our area, but there are, of course, a lot that don't make the headlines. So Savannah and Elizabeth, you both really see this problem firsthand. Let's talk about how big of a problem domestic violence is in the community. Elizabeth, let's start with you and then we'll go to Savannah.
Sure. I mean, we know that this is a massive public health issue. It is very common. It is absolutely, you know someone who is a survivor or has been a victim. Everyone does. So I would believe the most recent statistics are sort of 2 in 5 women and 1 in 4 men will identify having had this experience at some point in their lifetime.
And Savannah, I'd love you to weigh in on this as well.
Yeah, so I see a lot of patients when they are at the point where they're severely physically abused, and that's when they do come into the hospital. Unfortunately, it's really only 5% of people who come to the hospital and seek medical care after an event like a strangulation within the first 48 hours. And so we're actually seeing less people in the hospital than we know exists in our community. With that, we are still very busy. We are still seeing people all of the time for domestic violence and strangulation.
That's just awful. And Kelly, I'd like to bring you in here. Thank you, by the way, for being here. I know this has got to be really tough to talk about because you lost your daughter, Kelsey, after she was the victim of domestic violence. Share a little bit about her story if you feel comfortable with that.
Certainly. Well, in fact, today it's been 2.5 years since she died.
Sorry.
And the week before she died, we found out, actually through a friend who called us to tell us that she had been strangled and assaulted, and she'd been interviewed by the police had arrested and taken her abusive boyfriend to jail and charged him. And then she was taken to a local hospital in Lebanon. She was examined. Her medical records show that she was, in fact, not only assaulted but strangled. They also indicated that she had said she feared for her life and that she feared for the life of her dogs. She had 2 beautiful dogs. And we didn't find out about any of this until this friend called us probably 48 hours later, and we were in total shock. This was a guy that had been in our house, that they'd been going out for almost 3 years. Wow. We thought this was going to be our future son-in-law. And my husband and I just didn't know what to say. Kelsey called us about a day later and explained what had happened, reiterated the story, and said that, I said, you've got to come home. You've got to come home. You're not safe there. And she said, no, Mom. She said, COVID is starting to open up. She was a coach at Lebanon High School, a JV soccer coach and a varsity tennis coach. She said, the teams are going to start practicing. I've got to be there for them. I've signed contracts. This is my way to get back into things. She'd lost her job because of COVID, and she was just so anxious to get back with her girls, her team, and that was the last time we talked to her.
Looking back, Kelly, was there anything that you think could have changed the outcome as far as maybe resources for her or, access to resources?
Well, first of all, when she went to the hospital, she was never told nor forwarded to a sexual assault center right in Albany called Sarah's Place. She was not there was no diagnostic test taken, even though she admitted and was diagnosed as having been strangled. No MRIs, no CT scans, nothing to see any internal damage. She was given a sedative and sent home. And this is ridiculous. I mean, there should have been much more follow-up. There was absolutely no calls from the hospital afterwards. I have found no record of anybody reaching out to her after that happened.
You have gone on to champion for legislation that expanded resources for crime victims, and that is House Bill 2676. Part of that was expanding access to strangulation kits. Can you talk about what those are and how they would have helped, for example, in your daughter's case?
Well, actually, Savannah's the expert in that realm. I'll let her speak to that.
Sure.
But it was my understanding that strangulation kits, even though they were invented or introduced in that year, 2021, they were not available in Lynn County. But Savannah and her team of SANE nurses are very skilled in administering those, and they can make all the difference.
Yeah, Savannah, why don't you talk about that? How do they help you treat patients who have been strangled specifically?
Absolutely. So the strangulation kits are very similar to a sexual assault forensic exam or a rape kit. It comes with basically two things: documentation as well as forensic evidence collection. You don't have to have the forensic evidence collected in order to still do the documentation, but these kits help gather the information when it comes to injury documentation, their symptoms that they have, how long they were strangled, how they were strangled, and then the evidence collection and where they collect the evidence really assists patients to get justice, because nurses and doctors in emergency rooms, they do an incredible job taking care of patients, but they're not specialized to understand the needs of a strangulation patient, as well as the types of symptoms and things to look out for specific to someone who has been strangled.
And why specifically strangulation? Why is that such a red flag when it really comes to identifying domestic violence cases?
Yeah, so if a person is strangled in their intimate partner relationship, there's a study that shows that they are 7 times more likely to be victims of homicide. And so we want to get in and talk to the patient. We do also what is called a danger assessment that assesses the lethality of their relationship, so that they can take that information and understand how dangerous their situation is. We don't ever tell someone they have to leave or anything like that, but we do support them through resources and letting them know their situation is pretty dire.
You actually, Savannah, brought me to my next question I wanted to ask to Elizabeth, and you do hear that from people as why don't you just leave your partner? If they're abusing, leave. It should be simple, right? That's the question we hear. Why is that dangerous, or a dangerous phrase, especially when it comes to when people do leave an abusive partner? It is dangerous for them to do that.
Absolutely, it's the most dangerous time. If we think about, which we do, domestic violence as being about power and control, if someone is about to leave, that abusive person is about to lose control over that person, so things tend to escalate. It is not easy to pick up your life and leave. People have community supports, they have jobs, they have families. So it's there are a lot of barriers. So even if folks do want to leave, then there are, do I want a shelter? Our shelters are always full. Do I have someone else who can really listen to me and really support me and not victim blame, which that statement of why don't they just leave is a victim blaming statement. We like to reframe that.
On them.
Exactly.
Right.
We like to reframe that as why doesn't the abusive person stop what they're doing?
Sure. And you touched on resources here because it really is an issue. You're talking transportation, money, housing, oftentimes childcare comes into play. It's not so simple to just leave the home you're in. Let's talk resources, housing, all of those things I just mentioned. What is available, especially if there is not a shelter immediately there? Right.
Yes. So hopefully if folks are looking for shelter, if they happen to luck into a bed being available when they need it, that's wonderful. Sometimes we're able to bridge folks from a situation into a motel until a shelter bed can open up, or really just talk with folks and think about who are the resources, who are the people in your life who maybe you can go to for even just a little bit of time, so that you can figure out sort of what's next for yourself.
As we mentioned at the top of the show, BIPOC and LGBTQ people face disproportionately levels of domestic violence. Is there any specific resources any of you would like to point out, Elizabeth, when it comes to the often marginalized communities?
Absolutely. I mean, I think we can't underestimate the power of culturally specific services. Sure. There are a number of them in the area that are, so if you are a Latina, if you are a member of the Black community, there are places where if you are in the queer community who are really well placed to help you and really understand the specific needs and the specific barriers that those populations face.
Right. When we come back, we're going to talk about going through the legal system as a domestic violence victim. We're back in 2 minutes. And welcome back to Straight Talk. I'm Ashley Korslien in for Laurel Porter. We're talking today about domestic violence and what resources are available to people as they find themselves navigating a scary time. First of all, if you are in an abusive situation and you need help now, here is a list of phone numbers that you can call to get support. You can call or text the national hotline, or if you need it, we do have local numbers, one specifically for children and one specifically for people who speak Spanish. Now, our guests today are Kelly Harris, a mom who became an advocate for domestic violence victims after the death of her daughter, Kelsey. Savannah Powell is a forensic nurse examiner at Providence, and Elizabeth McKeever is the education programs manager at Raphael House of Portland, which provides shelter and domestic support for domestic violence survivors. Elizabeth, I want to talk to you about this first, is oftentimes we think that victims might go immediately to law enforcement, and that is not always the case. People might be very reticent to report it to law enforcement. Why is that?
Sure. I mean, I think it's a really intimidating thing to go to the police. What we know about survivors interacting with all the different sort of justice systems is that they often do not feel heard or seen, and really what happens after that report is made really is out of their hands at that point. And domestic violence is such an experience of being disempowered, and going into these systems and sort of having someone tell you, well, no, this is how this is going to go now, does not really feel helpful for folks often.
And Kelly, your daughter, you had found out your daughter hadn't reported that initially as well.
No, in fact, after her death, we found out she'd actually been involved in 2 different abusive relationships, neither of which she reported. And as a result, we found also that in both cases, the father of the abuser had been involved in the relationship and had threatened her. And in both cases, those men threatened her in the sense that they said they would either put down her dog, who had attacked her initial abuser, or that they would sue her because she was going to take the dogs with her. And anybody that knew my daughter knew that she loved animals, and she was even reticent about leaving the house of her last abuser because she was worried her abuser would come after her dogs. And she didn't think she could find a place to take her dogs with her. And I've since found out that there are safe homes like Raphael House that will allow victims to come with their animals. And I think that's really, really important because abusers will go after family pets.
That is such a manipulation tactic.
Exactly.
That really does connect emotionally to the victim.
The key here is if women don't report these, I have a saying, and I've probably heard it somewhere, if it doesn't get reported, it gets repeated. And I think that's really, really crucial for women to understand, is that gives the power to the abuser to continue doing what he's doing to them or to other women. And once it's reported, it's a difficult thing for them to go through, but it needs to be filed. It needs to be on record, because whether it happens to them or another woman in the future, you've got to protect yourself and you've got to protect others.
And if someone is arrested and charged, let's say with domestic violence, Elizabeth, oftentimes no contact orders will be issued. Are those helpful? Do they often prove to be fruitful for the victim?
They can be a helpful tool. A lot of survivors don't really like them because sometimes they feel like it can actually escalate the violence that they're experiencing, because that person has really been sort of, you're sending people after me now, right? So it can get worse. Ultimately, although sometimes they work, they are at the end of the day a piece of paper. And you're relying on a police response if there is an incident that happens, and sometimes that doesn't happen or there's a delay, and so it can be helpful, but not always. It's not perfect.
And Savannah, in a hospital setting, have you seen instances where the abuser will violate that no contact order in the medical setting even?
Yes, we have seen that. We see a lot of patients, we see a lot of repeat patients actually, and a lot of times they may have the contact order and then they go through and they want to go back to their partner. Something I tell my patients all the time and talk to my patients all the time is, like, we understand that, like, they may be really great. We understand that this is a cycle, and that, you know, they will give them a lot of love and a lot of compassion in between these abusive scenarios. And so I can validate that they do maybe want to stay in a relationship, just want to be in a relationship that's not hurtful to them.
Sure.
But ultimately they, you know, are come back, and we've had patients who have had multiple strangulations to the point where they have brain damage, and they are isolated and they don't have anywhere else to go. Patients who they have to go back because that's the only roof over their heads that they have at that time, and that's why they return. There's many reasons why they return. But yes, the no contact order is definitely violated at times. We try to keep at the hospital patients as safe as possible from their abusers. But of course, when we discharge, we don't have any control over that.
Right. Now, when it comes to the court system, what sorts of resources are available to a victim at that point? Elizabeth, do you want to take this one?
If folks are connected to the different domestic violence agencies that are out there, advocacy is something that we do, so we will accompany folks to court to really be that additional support. There are also organizations that specifically provide legal services for folks who have experienced domestic violence and sexual assault.
Is it hard to get these cases prosecuted? I mean, you hear oftentimes of charges being dropped or lessened. At the least. What's your experience been with that?
Yeah, you know, it's a mixed bag, and folks don't always, you know, survivors don't always get out of those systems what they're hoping for in the end. So part of that advocacy is also sometimes managing expectations of, you know, we don't know what the outcome is going to be necessarily.
And Kelly, it was tough for prosecutors to charge your daughter's abuser. Tell us what happened in that case.
Basically, you know, the minute she died, they dropped it, and they told me they couldn't pursue it because her abuser had, you know, basically refused to make a statement, and that she was dead, and therefore she couldn't go to court to prove that he'd done what he'd done. And for the last 2.5 years, I have been advocating and asking and begging and pleading and emailing and calling and saying, there's got to be more. Look at what I found on her Instagram. Look at what I found on her Facebook. Look at what I found in her email. You know, again and again and again. And they keep telling me, oh, that's not admissible in court. That's not admissible in court. And it's gotten to the point where I really feel like the criminal justice system has to step back and say, you know, are we favoring the criminal in all of this? But one of the things that is a bright hope is these DNA-based testing units, these strangulation kits, these rape kits, because now all of a sudden there's a fighting chance for these women in court. If they can't visibly show that, for example, in a strangulation like my daughter's, she didn't have visible bruises, but if she had been administered a strangulation kit, these are the kinds of things that would have made a difference. We need a statewide response so that all of the counties in Oregon can have access to these tools. Right now, only 11 out of 36 counties in Oregon even have strangulation kits or nurses that have these, you know, the training, or the doctors or the hospitals to do this sort of thing. And you know, this is going on every day in every county, and there are girls and women that are, you know, basically victims with no help. And in this day and age, with the scientific technology we've got to make changes. And so, you know, from that standpoint, this is a step. This is a hope. This is a fighting chance in court.
Elizabeth, I'm going to let you have the last word here. Any changes you'd like to see done in the future, or advice to people to spot abuse in their life?
You know, I think if you are lucky enough to have someone trust you to share their story with them, it is incredibly important to really just sit with that, tell them, I believe you, it is not your fault, and tell me how I can be best supportive to you.
All right, well, thank you all so much. I know a very tough subject, but very important. You've all really shed a light on a really important conversation that we need to all be having collectively. So thank you for being here, and thank you for joining us here on Straight Talk. Next week, we're talking with the Cannabis Industry Alliance of Oregon about the state of the cannabis economy. Have a great week, and thanks for joining us.